recorded. Well, welcome everybody. My name's Priscilla Andrews. I am the clinical director here at the Cancer Wellness Center. I think this is my first webinar as clinical director, so thank you for being here. Even though I just transitioned to the clinical director role in January, I've been with the center since 2006. So I've been here a lot longer than I've been in this role. And I think I've been doing treatments done now for, oh my God, at least probably 15 years. So I'm very passionate about the post-treatment phase of having a cancer diagnosis, and passionate about supporting people as they make this transition, because I think there's a lot of unexpected experiences that people have when they finish treatment that really catch them off guard. So hopefully, if you are currently already post-treatment, this will be validating for you and maybe prepare you for some things you haven't yet experienced. And if you are still in treatment, but at the tail end of treatment, hopefully we'll leave here with a bit of insight into some of the things that you may experience as you move into post-treatment. Now, I should say, I am not a medical professional, so I'm not going to be talking about like side effects or long-term side effects, anything from that medical perspective. We're really going to be talking about, what are some of the common psychological, emotional experiences that people have, and what are the things that can be helpful for you as you make this transition to help you cope in as most high successful satisfaction quality of life way. So with that, I'm going to share my screen. Okay. And you may notice that I am going to sometimes look to one direction, and that's just because I have two screens. So I may look at my other screen to be able to see my slides. Okay, so what are the objectives for this morning? I guess it's not quite afternoon yet, but we're bridging the gap here, right? So one thing that I am going to talk about right up front is talking about your nervous system. That is one of my other passions, because our nervous system so impacts the way that we experience the world and the way that we respond to things that happen to us. And so I think that helps give context to some of the things that you may be experiencing yourself, and to hopefully help normalize them as part of a biological process that is not saying something about you, but is saying something about how we as humans come pre-wired. We'll talk about some of those common responses that people have. This is not a 100%. I'm going to talk about things that you might highly relate to, and maybe some of the things that I talk about are not going to be things you're experiencing. That would be my expectation. So don't feel like it has to be this like one-to-one checklist here. And then we'll also talk about some tips for transitioning into survivorship. And also ask questions. I know it's a little different in the virtual world, but I do hope that if there are topics that I bring up that would be helpful for me to clarify or expand upon, that you do feel free to throw that up in the chat. So I like to talk about some definitions just to start out with here, just so we know that we're all working kind of with the same set of information. So before I put this up, I'm going to ask people already to participate a little bit here in the chat. And that is, how do you feel about the term survivor? Is this a thumbs up? Are you love it? Are you neutral? Do you, like, if somebody calls you that or refers to you as a survivor, you're okay with it? Or are you like, I hate that term, and I hate the fact that people keep referring to me as a survivor, or it gets under my skin. I don't identify with it. Having some form of, um, like, let's say, like on a scale of 1 to 10, you're at least at like a 4.5. You're like, not for me. Not sure I've got, it's okay. I feel neutral, not sure how I feel about it. I'm okay with it. So the reason that I start with this is when I would do this in person and I would ask this question, I got a lot of energy about it in the room. And there were people that were okay with it. There was typically like a couple people that were like, I really love the term. And then there was a whole handful of people that were like, other people call me that, but I don't identify with it, or I don't really like it because it doesn't feel like it fully encapsulates my experience. Because yes, I'm done with treatment, but I'm still dealing with side effects. I'm still trying to make sense of what happened to me. What did I survive? Like, this is ongoing, right? There's lots of different ways people relate to it. So I like to start here to say, like, if you are not identifying with the term survivor, right? I see a lot of okays. And to me, okay could go either way. Okay could be like, okay, you can call me that, but I would distinguish that from okay because I self identify with that term. So it's a much used phrase that many people who have the cancer diagnosis themselves get labeled as versus identifying with it, right? So when I first started here, we used to refer to everything as cancer survivor. And I got lots of questions from people saying, well, does that apply to me because I'm still in treatment? And then we'd have to say, yes, it applies to you because you're a survivor from the day you were diagnosed. And people really didn't identify with that based on the very fact that I had to define it for them so that they assumed that or knew that our programming applied to them, right? So I see survivor as a tricky term. A term that I actually do like and I find useful is survivorship. And I'll tell you the reason that I like survivorship, okay, is that it really speaks to the fact that cancer is not just a physical ailment. Yes, it is. It's a medical diagnosis. It occurs in a body. It is a biological system. However, cancer has little tendrils like a spider web that shoot out and can impact a whole web of different aspects of your life, right? It can impact your relationships with other people. It can impact how emotionally you're feeling. It can impact your sense of identity. It can have a financial impact, right? There's all these different ways that cancer comes to bear on your life, both when you're in treatment, but also following up when you're moving into post treatment. And the reason I like survivorship is that it really is intended to highlight that fact, right? Cancer is not like getting a cold and then you don't feel well. And then when you're done, then it's all over. Certainly for some people, that can be the experience that they have. I don't want to discredit that. I would say most of the people I encounter when they're done with treatment are left grappling with something that they are trying to come to terms with or trying to make sense of or adjust to because of the diagnosis that goes beyond just the medical impact, the physical impact of it. Okay, let's talk a little bit about expectations. Okay, I call it, you're shooting all over yourself. There's a lot of ideas of how people should feel when they're done with treatment. I think the number one thing is I should be celebrating, right? I ring a bell. It used to be, and I think some places have brought it up back. You ring a bell on your last day of chemo, or the number of people I know who like their family is all going to go out for dinner to celebrate after they finish their last chemo, right? And what I often hear is my family expects me to be excited. Oops, excited. My family expects me to want to like go out and like party and celebrate, and I'm just not feeling it. Like I'm glad treatment is over, but I've got these other feelings that are coming up for me, right? I think another misconception is that, hey, once I'm done with treatment, all of a sudden, all of the wear and tear on my body that treatment has had is going to be all done, and I'm going to be back physically to the person that I was before. Now, I always like to highlight the fact that, like, one rubric I've heard is that for every chemo treatment, expect a month of recovery. So if you have 6 chemo treatments, that's 6 months to start getting back closer to maybe a baseline or what your new baseline is going to be, depending on what the longer term side effects of your treatment are. Right? So you're not going to physically feel like yourself again. I should be the person I was before cancer, right? Cancer and cancer treatment takes months and months and months, can take over a year, right? There's very few other experiences that um, dictate our life for such a long period of time that we would not expect it to have some impact on how we feel and who we see ourselves as individuals. But I think when it comes to cancer, there's this expectation that as soon as this cancer thing isn't, hanging you up and taking up your time, you're going to go back to exactly who you were before, exactly how you were before, wanting to do exactly what you did before the diagnosis. And again, while that can be true for some people, there are many people that find that after the cancer diagnosis, it gives them pause around something in their life that leaves them feeling different, feeling maybe less carefree. Maybe the cancer diagnosis pushed against some belief systems around how the world worked, right? If I'm healthy, if I eat healthy, if I exercise, then I'm going to be protected from any medical conditions. And then a cancer diagnosis comes along. This is just an example that I've heard on a regular basis. And so how do I make sense of the fact that I thought I did everything right and I still wound up with cancer? The other thing that can happen is I'm not going to need support, right? Maybe I had my family and friends around me. They were checking in on me. Maybe they were bringing me meals. They were helping with carpooling for the kids. And well, once my treatment is done, I'm not going to need that anymore. And also, what I should feel more than anything else is I should just be grateful. I should be thankful. And I will say, I think that there can at times be a reinforcement of that within the medical system when I hear people bringing up quality of life issues with their healthcare team, and that being something that is really impacting how they're experiencing their life and their life satisfaction, and the response being somewhat like, yeah, but look, you're here, aren't you glad that it worked, right? We got you to be no evidence of disease, and the implication being, well, you should just be thankful to be alive, and that should be enough. When the reality is there's all kinds of impacts on people, right? Like you've got neuropathy really bad and you can't do the physical activities that you want. Your diagnosis, whether it be the physical impact or the psychological toll, has impacted your sex life, for instance, or your sexual health, right? These are things that are going to impact who you are, your sense of self, your enjoyment of life. That yes, while you can be grateful that the treatment worked, there can also be all of these other experiences that you're having simultaneously. And I actually had one of the people who attended this brought this comic up during one of my presentations, and I was like, oh, that's so good, I got to include it, right? One of the challenges about finishing treatment is you have this whole ecosystem of support around you. You've got your oncologist. Maybe you've got a medical oncologist. Maybe you have a surgical oncologist. You could have a radiology oncologist. You have nurses. You've got techs. You've got the check-in staff, right? You've got all of these people that you're interacting with on a regular basis. And then all of a sudden, when you're done with treatment, it is like you are a little baby bird being pushed out of the nest and being told to fly, and we'll see you in 3 months or we'll see you in 6 months. And so you go from having somebody very readily available to answer your questions, to provide reassurance, to kind of flying on your own. And there was this woman, Jimmy Holland, who was sort of the grandmother of psycho-oncology, right? That's basically like the study of how cancer impacts psychologically and emotionally impacts people. And one of the phrases that she said was, you can be disease free, but not free of the disease, right? Even if the cancer is gone, even if there's no evidence of disease and you're in remission, the ripple effect of what this experience has meant to you, the impact it's had, can go beyond the walls of whether or not you have active disease. So I want to talk a little bit about how we react in a crisis. This is where that nervous system stuff comes in. And this is just how we respond to stress, right? There was this guy, Hans Selye. He was an endocrinologist back in the in the 1950s, 1960s. And he really provided a foundational understanding of how we respond to stress. And what he created was what's called this general adaptation syndrome model, which really looks at like when we're in a crisis, what happens. And there's sort of this predictable pathway that we take. Okay. And so what I want to encourage you as I'm talking about this is to just be thinking for yourself, where do I see myself on this trajectory? Where do I see myself on this graph, right? Some of the things that he discovered, one is that we all have a certain resistance level to stress, right? That's sort of our innate ability to weather the wear and tear of stressors. And that means that we can absorb a level of stress without showing any signs of stress. And we can think about like there's some people who have really high resistance to stress, like everything sort of seems like it rolls off their shoulders. They seem to really be able to like get through stressful situations and thrive and do well. And then we have the people, I call them, they get cancer of the hangnail, like everything is a crisis, right? So that was one thing that Selye discovered, is that we have this stress resistance. We're going to just, for the sake of this conversation, we're just going to say we're the middle of the curve. We're all kind of this average resistance to stress, right? So then the next thing Selye discovered was that in the immediacy of a stressor, of a crisis, right, it actually impacts our resistance to stress and decreases that resistance to stress. So that's, if you think about like when you were first in the early days of your diagnosis, maybe when you first heard that you had cancer, maybe in the days following that, you probably showed some of your signs of stress, right? And he called this the alarm phase. So when we think about signs of stress, right, those signs of stress can fall into these four categories: cognitive, emotional, behavioral, physical. And it's it's typical for us to have a constellation of different signs of stress that fall in these different boxes, right? It's not saying that you're going to experience all of these specific signs of stress, right? But I think of it like if you're old enough, you remember when you'd have the big old stereo and there'd be a tuner and you'd turn knobs and there'd be these kind of, you create different wave patterns, right? With these, I don't even know what you were messing with. And that's sort of how I think about these different signs of stress. Like some of them may be very dominant for you and maybe one of the first things that show up for you. Maybe some of these other signs are there, but like you have to be under a lot of pressure for them to show, right? We're each going to have our own profile. But you can think back, during the early time of your diagnosis, of which of these signs may have shown up for you. And one thing that I want to note here too is, because I'm using this word crisis, right? Because cancer is a crisis. It's a manageable crisis, but it's a crisis nonetheless, right? And something to think about even when you're looking at these four different categories of signs of stress is cancer may be the biggest stressor, the biggest crisis that you've ever experienced, or may have been through other crises, and the cancer is situated amongst those other crises. And maybe the cancer wasn't the biggest crisis that you've ever experienced, right? I had a client years ago who had a very, very serious blood clotting disorder. and it was like fatal, and there was some things they could do to control, but it was chronic. And that was a much bigger crisis for them than the cancer diagnosis. The cancer diagnosis still felt like a crisis. It just was relative to the other experiences that they've had. So it may be that as I'm talking about this curve, that it may be bringing up other crises that you've experienced that maybe stand out equal to or maybe even more so than the cancer diagnosis. And and you can see here too, like I want to also say, like, there's often this experience of opposites being true, right? Like under behavioral, repetitive movement, right? I'm fidgeting, I can't sit still, I'm biting my nails is a behavioral sign of stress just as much as being like no movement, I can't move, I'm kind of frozen, everything feels like an effort, right? You've got two things that like energetic ends of a scale, but both can be a sign that your system is under stress, right? That your resources are being pushed against. Now, the thing that's great though is that we've got these stress hormones, cortisol and adrenaline, that come on board to help us deal with the stress, right? And this is what Selye referred to as the resistance phase. Now, the challenge is that while this is adaptive, it's how we come designed, it's really designed for short-term bursts of response, right? So like think about like you're getting off of the highway, you get rear-ended, all of a sudden your heart is racing, maybe you've got tunnel vision, you get out of the car, you're like, oh my God, is the car okay? Is the person going to get out of their car? The other person gets out. You're like, okay, I got to get my stuff together. I got to get my insurance. We're going to talk. Are you hurt? No. Are you hurt? No. Okay, we're okay. And then that crisis, even if there's still follow up, the intensity of it gets resolved kind of in a short time frame, right? But what happens with cancer? It goes on and on and on, right? You have the diagnosis, you've got testing, you've got treatment planning, you've got maybe surgery, maybe you've got chemo, maybe you've got radiation, maybe you've got immunotherapy, right? There's this whole series of events that can go on for months, can go on for over a year, right? So what happens? At a certain point, all of us our resources are gonna be exhausted, right? And so what happens when we enter that exhaustion phase is that our resistance to stress doesn't just return to where it typically would be, it's lower than it was before we went through that experience because we've been running at such a high demand level for so long. So what do I hear a lot? What I hear a lot is, things that used to not bother me bother me. I'm super short tempered with my spouse. The commercial comes on and I start crying. The song comes on and I start crying, right? Like I feel like I get overwhelmed. I used to be able to multitask, and now if I've got more than one thing going on, I just completely can't handle it and I shut down or I freak out, right? And that's because where your resistance was to stress is not where it was when you started out. Now, the good news is that we can do things to help elevate our resistance to stress, to help us return to our baseline, to give us tools so that we can return to our baseline resistance of stress in a more efficient way, that we can, over a longer period of time, we can actually elevate our overall resistance to stress. So this is not a permanent state that you find yourselves in. And I should also say that you may look at this and you may feel like, Priscilla, I have cycled through this curve multiple times throughout my diagnosis. Or you may say, I hit that exhaustion phase way back when I had to make the transition from chemo to radiation. And then I feel like I went back up I reached exhaustion. And then because of what was being required of me, I went back up to this like heightened resistance phase. And now I feel like I'm bottoming out for a second time or a third time, right? It's not necessarily like everybody's curve is like diagnosis, treatment, 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 and then a crash. I'm going to pause here just to see if there are any, because somewhat technical information. Wondering if there's any questions or any comments that people would want to throw up, or if you'd be open to in the chat, sharing like where you find yourself on this curve. If you really, maybe you still find you're in the resistance phase, maybe you find you're in the exhaustion phase, maybe being without your care team has sent you back into an alarm phase here. Any questions or anybody willing to share how they might be relating to this curve? I'm going to feel free to throw that up there. I'm just going to move on to the same slide. And if anybody shares, right, somebody just said any new ache or pain causes stress, right? Really common, right? Once you've got the cancer goggles on, it's really hard not to view everything filtered through that cancer lens. And I'm going to talk a little bit about that in a couple slides, actually, about like how you can utilize communication with your doctor to potentially lower some of that stress and anxiety. But certainly, right? Like, and that might not have been how you were before, right? That's one of the things I'm talking about that may be different for you now. Maybe before you didn't catastrophize when you had symptoms, or it was easier to like wait a couple days to see if it went away before you started being concerned about something. Whereas now you got the headache and you're worried right away. Oh my God, is it back and is it my brain? Or I got that backache. What does that mean? I will also say one of the things that can also be triggering is like if you have symptoms that mimic symptoms you had before you were diagnosed, that can be really stressful. And we're going to talk about triggers at the end of the presentation because that can be big trigger. I love this, right? So somebody says, I don't love that you're exhausted. Somebody said they're exhausted physically and emotionally. Now, I'm going to have to pay this person because they said, I feel a variety of emotions. Maybe you saw my next slide. Right? It's normal to have a whole host of emotions. And I don't know a single therapist that does not love the movie Inside Out. If you haven't seen it, I highly recommend it because I think one of the things that that movie really highlights is that we can have multiple emotions that coexist at the same time. We just often feel most comfortable when there is that one emotion that we're experiencing in solitude, right? But we can feel relief and gratitude while also feeling stressed out, anxious, angry. It's not an either or, it's an and situation, right? Um, and I think a couple that I want to just highlight here is I think that isolation can catch people off guard, along with just having any of these emotions. So that's where the confusion and surprise can come in, right? Feeling maybe like their support system is not as present as it once was during treatment. Maybe feeling like people are expecting you to feel differently than you do. Um, Maybe feeling like people don't understand what you've been through or what you're currently going through, right? Those can all be very isolating experiences. I also think something that is overlooked is numb, right? I'm not feeling anything, right? That is also an emotional experience. It is a adaptive survival instinct that our system has when our circuit board gets overwhelmed and cannot be holding all of this all at once. So numb is the most worrisome. Numb is I'm numb to everything. I'm not feeling sad, I'm not feeling anxious, but I'm not feeling particularly happy. I'm not finding that I enjoy things, like, right, everything just feels vanilla, right? That would be numb. When you're in a situation where maybe before you would have had an emotional reaction and you don't, or you're in a situation where maybe you look around the room and you're like, everybody else seems to be feeling something about this and I am feeling nothing, right? That can also be a sign that your system is in that exhaustion phase. And hey, that is like an adaptive thing that your nervous system is doing to help protect you from how much stress you've been under. We just don't, if we get there, we don't want to have to stay there for longer than necessary. I had a couple people say many people don't understand where you personally are post-treatment. Somebody else said, I feel like I'm fine until my 3-month visit and I have my labs and CAT scans. It's a roller coaster, right? The term scanxiety. I can put it out of my mind. And then the days, the weeks before the tests, then I start getting worried. It's harder for me to connect to what my doctor said about my prognosis and how well my treatment went. I start having creeping thoughts of doubt. I'm anxious about what's going to happen. I'm anxious about undergoing the tests. I don't like being in the machine, right? All of that can be very provocative. And so there is this roller coaster effect where it's not this one note experience that's consistent. And that can be circling back to what somebody said about people not understanding, right? That can be one of the challenges is if the people around you are expecting you to feel a certain way and the people around you are expecting you to be more consistent in your mood when maybe your mood is fluctuating, that can be very difficult within the context of that relationship. It can cause conflict. It can cause people to feel misunderstood and feel isolated, right? Difficult things to experience, which circling back to what I said earlier, right, is cancer is a medical condition, but it has all of these other manifestations that impact our quality of life, our sense of self, our relationships, etc. And so, as I mentioned earlier, right, there is this life experience that you have went through if you're in this room that it dictated what you could do, it dictated how you felt, it increased your engagement with the healthcare system, maybe it caused you to have to put on hold plans or routines in order to dedicate yourself, or maybe you were required physically to have to focus on your physical well-being in a way that was not typical for you, to come out on the other side and not have that have an impact on how you view things. Not a whole lot of life experiences that we have that we wouldn't expect somebody to have some new perspective or some change in their sense of identity or their emotions because of that experience. But the people in our life, in your life, maybe they want you to just go back to how things were before. Or maybe what I also hear is my family is very understanding and very compassionate and are not putting pressure on me. I'm putting pressure on me. I want to be back to how I was. I want to feel the way I did before. I want to be able to physically do the things I could before and I can't yet. I want to do the things I wanted to do before and now I feel differently about them, right? So the pressure to return exactly to how things were before can come from outside of us. It can also come from within. And so, number one tip here, be patient with yourself and others, right? Now, of course, if I could bottle up patience, okay, to be perfectly fair, I love my job. I would not be here. I'd be busy making a circuit on the like toddler parent circuit and selling patience in a bottle, okay? Because if patience was that simple, to just say be more patient, uh, then I want a bottle of that, right? But patience is really something that we can cultivate. So, how do we cultivate patience? Well, there's a few things that we can do, right? First off, the value of focusing on each day and recognizing that you are going to have good days and you're going to have bad days, and sometimes they're going to be in the same day. Now, one of the things that I think is really helpful about that is if you start to notice a pattern, then it gives you agency around how you want to manage that pattern. If you find that you have energy in the morning and it bottoms out at 4 o'clock, right? Does that mean you make more of a point of doing enjoyable activities earlier in the day? Does it mean that if you have that evening outing with friends or family, that earlier in the day you take it easy and make sure you take a nap so that you can enjoy the the pleasurable activity. Because what can also happen is we start to invest a lot of energy in the things we should or have to do and leave very little energy left over to do the things that nourish and replenish us, right? And that the putting aside the nourish and replenish us stuff is coming at a time, number one, when our system really needs that to recover and heal from what we've been through. But it's also coming at a time, and it's also coming at a time when our gas tank is not as full. And so we have less. And so we want to be judicious about where we put that energy, and understanding if there is some pattern to where your energy level is can be helpful at being intentional about where you spend that energy. Doing things at your own pace goes kind of right alongside with that, right? Things may take longer. Maybe you can't multitask in the same way because you're recovering from chemo brain, or, energy wise, there's only so many things that you can accomplish in a day, right? So, and knowing that there is progress over time, typically when it comes to energy level and mental capacity, emotional capacity. One thing that I like to encourage people is, a lot of times what we do is we say, okay, there's my goal and it's at the top of the mountain. And my goal is to be somewhat where I was before I started, right? I want to be able to physically go for the walk. I want to be able to babysit the grandkids, et cetera, right? And so then we just keep our eye on the goal. But what that does is it can make what's invisible is have where we were and where we've come from. So if there's a gap here, we're not there yet. We're just looking at the gap and we're not really appreciating how far we've come. So what I always recommend to people is, think about your worst day physically, your worst day psychologically, and use that as your comparison point, because that is going to allow you to see the steps that you've made in the direction that you want to go in towards healing and recovering from what you've been through. And I think that's where that giving yourself permission to heal, setting realistic goals for yourself, grief is a normal human reaction to when we lose something, right? And we think about grief as being related to losing a person or maybe losing a pet, but we have lots of other losses that we can experience. And cancer can bring with it many different losses, some of them temporary, some of them permanent, right? The loss of time, right? We're coming out of the summer. If you're just finishing treatment and you've been feeling crummy, maybe summer wasn't how you normally wanted it to be, or maybe you didn't take those trips that you would normally take, right? It can be a sense of loss of feeling healthy, right? Some people feel like after they're done with cancer, like, can I consider myself a healthy person? That gets called into question. Maybe you've actually had changes in body parts, right? If you've had breast cancer, maybe you had a lumpectomy or a mastectomy and your breasts are different. If you had prostate cancer, maybe it's impacted your sexual functioning, and that's not going to be something easily recaptured in the same way, right? And there's also the temporary loss. I think that is one of the challenges, is like when you're post treatment, like how you're feeling today is unlikely to be exactly how you're going to feel a month from now, 2 months from now, 3 months from now, right? So that loss of certainty of what to expect for yourself can also be challenging, even if it's temporary. And also, you're going to get mixed reactions from family and friends, right? Like, as that person said, many people don't understand post-treatment, and you may be experiencing that. And that could be really explicit, right? It could be like, oh my God, you must be so happy to be done with treatment, just so grateful to like just get moving on, right? Right? Very explicit message about how you should be feeling. It could also be much more implicit, right? Your child with your adult child with young kids comes to you and says, hey, can you guys take the kids for the weekend because we want a weekend to get away, right? What's the implication? The implication is I have the energy to do that. The implication is I have the desire to do that. The implication is I have the like mental bandwidth to do that, right? So lots can get implied in simple requests or expectations of what you're feeling capable of doing or having a desire to do. And for some relationships, maybe they're going to be important enough that you're going to feel like you need to speak up. Maybe I would say educate that person and help them readjust their expectations. There's maybe some relationships where you found yourself like distancing yourself from somebody and you're like, I just don't know that I want to have that person in my life right now because I don't feel like they really get where I'm at. Right? That can vary greatly. Some people you're kind of stuck with, right? If it's your spouse that you feel like doesn't understand, or it's your adult children or your children that don't understand, right? I would say, just as a plug, I think that's where our counseling services can sometimes be helpful, is having people come in as a couple, having people come in as a family to sort of reset expectations and help people be on the same page and be able to talk openly about what is going on under the surface that may be creating some tension around what post-treatment actually looks like versus what people expected it to look like. Um, okay. And I do want to acknowledge somebody else shared, this fear of recurrence that causes stress and anxiety that can come up around that 3 month, right? Maybe I can set aside my fear of recurrence. And then when I know I have to re-engage with my healthcare team, when I know I have to go for the test or the scan, all of that fear about what is going to happen. And I think that can happen over time, but especially those first several rounds of tests and surveillance can be particularly anxiety provoking, because when's the last time you had those tests? Well, the last time you had those tests was to confirm you had cancer, or one of the last times you had, right? So like one of the more salient memories you have is going in for those testings and hearing something you never wanted to hear, right? So it's completely understandable that there is anxiety going into those tests. And the question then becomes, what can I do to help manage that stress and anxiety? What can I do to make sure that there's realistic expectations in my support system as far as how I may be feeling or what type of support I may be needing, versus I'm having to hold on to this and like, what's wrong with me that I'm so stressed and anxious because the doctor said everything's fine. Okay. So any comments? I'll pause here for a moment. Any comments or questions before I move to the next tip and strategy section? You can throw it up there in the chat. And what I will probably do is I will move on, and then if somebody decides they want to put something, I'll just circle back and rewind for a moment. Okay, so how can we feel empowered, right? Empowered, I think other words I would think about is like agency, right? I have a sense that I can make choices, that I can direct what happens, that sense that of being in the driver's seat, or being clear about the things that you're in the driver's seat about, because it's challenging, right? Like you didn't choose to get cancer. You might not have chose your day of treatment. Sometimes there's some choice about treatment, but sometimes it's sort of like you do the treatment or you don't. So it's a little bit of like a false choice, right? So how can you feel like you are back have more of a sense of control, right? So one of the things that's really valuable is to be informed, right? We're very creative. We like to fill in blanks as humans. And so it's really valuable and beneficial to have conversations with your doctor. Now, when you were first diagnosed, they probably talked about your pathology report. Maybe they talked about why they chose the treatment course. Maybe you had questions, maybe you didn't. Maybe you were like, hey, I'm going to do what the doctor tells me. I trust my doctor. So now you're post treatment. Maybe now you do have questions. Or we know that when we're in a crisis, our brain does not process information in the same way or store it in the same part of our brain. So even if your doctor went over information when you were first diagnosed, you may not be able to retrieve that information, or your way of understanding it may have changed. So please feel encouraged to return to conversations you may have had earlier in your diagnosis so that you can understand, to the extent that you need to, what just happened here, right? Um, and part of talking to your doctor at this point is about survivorship care planning. Now, some hospital systems or oncology teams have a very like formal process for people to go through survivorship care planning. Other people, other hospital systems, other oncologists don't. Maybe your healthcare team hit on these categories with you without calling it survivorship care planning, right? But what is survivorship care planning? It is having a comprehensive medical record or understanding where you can get that information. Now, with electronic medical records, there's so much that we can access. Um, and that's where that understanding, how much depth do I want to understand of like why they chose the treatment they did, why did I have the side effects that I had, what exactly did the biopsy mean, what were those genetic markers you talked about, right? Those are all conversations that you can have with your doctor again, even if you had it before, or if you didn't before and now you want to have them. The other thing is also thinking about like surveillance plan. What's my testing, right? We've had some people talk about labs and CAT scans, right? Like what's the frequency of that? It can be helpful to talk to the doctor about like, are there long-term or late-term side effects? I also think it can be valuable to talk about what symptoms are you going to be monitoring for? Because I do think asking that question can sometimes help diffuse the anxiety that comes around having any physical sensations or ailments in your body. Right? Because your doctor may be able to clarify, like, well, I would expect, like, it's not going to, you're not going to have a stomach ache. You're not going to have a headache. Like, that's not how this is going to show up. Right. Like, so that when you have a stomach ache, when you have the headache, your brain is not going straight to having a recurrence. I think the other thing that can also be helpful too is talking to your doctor about your oncology team about what do you want me to go to you for versus what are you expecting me to return to my GP, my internist, my gynecologist to address. Because when you're in treatment, typically your medical oncologist is kind of the quarterback for your healthcare, and you're going to go to them and they may refer you to other people, but they're going to kind of be your point person versus as you move into post treatment, there may be an expectation of like, oh, well, if you've got that symptom, don't come to me, go to your GP. And so having an understanding about that up front can help shorten the amount of time for you to get connected to the correct healthcare person. Because if you're going after your oncology team and waiting to hear back from them, and then all you hear is, oh, well, that's not me, go to your GP, right? We're just going to cut out that middleman. And your oncologist might say, hey, for the next 3 months, 6 months, check in with me. I want to hear what's going on with you, right? That's also, then okay, that's my person still. The other thing that some people want to discuss, and this is under the asking your questions, and this can be is a very personal choice, is what type of discussion do you want to have around prognosis? Some people don't want to have that conversation. They say, I am a sample size of one, and I'm not interested in hearing statistics. I'm not interested in hearing likelihood of recurrence, right? And so you kind of have a sense of like, that's what's going to work for me. Other people can find it helpful to have a sense of, what's the likelihood of recurrence. Some people I used to run a group for women with ovarian cancer, and there were some women in that group who had a recurrence, and people would come in with their initial diagnosis and be completely freaked out, right? But then they'd come back again and they'd say, it actually helped my anxiety to know this is what would happen. This is what treatment would look like. This is what we would do, right? So you can make a decision for yourself of, is that type of information and being able to have an actual accurate understanding of what would happen, is that going to put my mind at ease, right? If you're like a planner, like that might be really helpful to be like, okay, like this is what would happen. And so now I know, and I don't have to worry about it, making a plan or what would happen because my doctor and I talked about it. And I hope I don't need to use that plan, but I got it back there in case I ever have to take it out, right? Um, okay. So the other thing that I will also mention is communication. I love this acronym of thinking about when you're communicating with your healthcare team, the different components of it, right? Prepare, ask questions, prepare your questions, write them down. I even say type them up when I go to a doctor's appointment for something like serious, right? Like more substantial. Um, I will type up the questions. I will bring my own copy and I will give the doctor a copy and say, these are our questions, right? My husband had to have hip surgery several years ago. This is our agenda. So right up front, they knew, and even if the doctor didn't have time with us, they were like, I'll send my PA in so they can finish answering your questions, right? Obviously, you got to ask the questions once you have them. Now, the thing that I think most people do the P, they do the A, they do the T. They follow up with what the doctor is suggesting that they do. They go have the test or they follow up with the nutritionist or whatever it is, right? Or they come to the Cancer Wellness Center. What people are like, oh, that's interesting, is repeating back what you've heard, right? Okay, doctor, so what I understand is I'm going to see you every 3 months. And then what you want me to do is plan to see my surgeon 3 months after that, because then I'll see you again 3 months after that. Is that what I'm hearing? And that if I have questions, I should contact you first, regardless of what's going on, right? I want to make sure that I'm leaving with a clear understanding because one, if there is some misunderstanding between you and your doctor, it allows you to clarify that. Two, if you've made an interpretation of the information that they've given you that's not accurate, then they can clarify that. And three, sometimes when you repeat back what you've heard, it allows the doctor to kind of yes and you. Maybe it highlights for them that they've left off something important, or maybe they are able to reiterate something that they said that didn't stand out to you, but that they want to make sure that you've absorbed. Okay. Before I go, I'm going to pause here again to see if there's any questions or comments about the communication information with your healthcare team. Okay. I'll do what I did before. I'm going to pause, but feel free to throw things up in the chat if there's anything that you'd like me to expand on or any part of your own experience that you would like to share or feel open to sharing with the group. Okay, other part of empowerment is this kind of two-pronged approach of cultivating mind-body awareness, right? One is relaxation practices. The other is being physically active. And both of these have a biological basis for why I'm suggesting them. Let's talk about relaxation practices, okay? Optimal healing occurs when we're in a state of homeostasis, right? That's that like middle line where your stress resistance is not being pushed against. And you're kind of like all your systems are working in their optimal level. Now, when we face a threat, right, like cancer, not feeling well from cancer treatment, being worried about what's going to happen next with our health, our nervous system is designed once the cues of danger outweigh the cues of safety. And I want to make a distinction between reality of danger versus cue of danger, right? It doesn't matter whether or not we're actually in danger if there's enough information coming into our system that tells us, uh-oh, then we are going to move into a survival state. And that move into a survival state is preconscious. It happens in a part of our brain that has a faster response time than our thinking brain. So by the time we've been pushed into this state to try to keep us safe in this sort of environment that it's deemed as having too many dangers, by the time we become aware of that, it's already happened, right? We can increase our awareness of when it happens. We can increase our awareness of the things that cause it to happen, but it still happens before we can say, don't do that. And so we have two different um, options as far as a survival state. We either get like super alert, hypervigilance, rush of energy, like our system is telling us to do something. And that do something could be physical, but the do something could be mental as well, right? My thoughts are racing, I'm making lists, I'm problem solving, I can't stop thinking about things, right? That is also energetic. The other system, that the other state, survival state we can go to, is one of like a turtle pulling its legs and head into its shell, right? We kind of go into this like immobilized state. That's, if you relate to being numb, that's that is the one of the experiences associated with being in an immobilized adaptive survival state. Um, and that exhaustion of being in that numb kind of shut down state, that sort of like I'm here but I'm not really here. Sometimes we can get pushed in that if we've been in this like heightened alert energized state for too long, right? So relaxation techniques, there are 20% of our nerves go from our brain to our body. 80% of our nerves go from our body to our brain. And when we get into survival state, we can get into this loop where our body responds. It's got these stress hormones, it's tense, our heart rate is elevated, right? Our respiration is more shallow. And that information gets sent to our brain, and our brain is like, oh, well, I guess Priscilla's in trouble, better keep that going, right? And so when we do relaxation techniques, we're basically taking advantage of that and helping our body to relax so that it starts sending up a message to our brain that says, call off the guards, call off the soldiers, right? Like, she's safe enough right now, right? If I'm being chased by a bear, I'm not going to be able to do deep breathing because I'm too busy figuring out what I'm going to do to get away from the bear, right? But if I'm able to like take some deep breaths and be able to relax my muscles and slow down my breathing, it's going to give that message that says, okay, there must not be like a present danger. Right in this moment, there is not a present danger. That's a message we're sending to our brain. In this exact moment, there's not a present danger that is imminently going to harm. Um, so there's lots of different options. And I want to acknowledge, I saw somebody's comment come up, and I'll come to that in just a moment. Just want you to know I saw it. So there's lots of different things that we can do. Many people I know that I've worked with before diagnosis, like explicit stress management techniques was not something that they did. They did things they enjoyed, they did things that helped them relax, but actually having practices and having a routine of things to do to help with relaxation wasn't a part of their like day to day. And so I think that's part of what can be beneficial about the Cancer Wellness Center is there are these different ways that you can try out different methods and different stress management techniques to find a best fit for you, and have those techniques be within the context of other people who are dealing with a cancer diagnosis and working with people that have experience working with a particular frame of cancer related stress, right? So we can do things like yoga, a stress reduction class, which could be like guided imagery or progressive muscle relaxation, doing something like Tai Chi, meditation. We could also think about creative outlets can also be help us get to like a flow state where we're really being able to be mindful and focused on the thing that's in front of us. So things like painting, drawing, journaling, music, and also social connection. And I apologize because I think I still have this. I've not gotten rid of it. I revised this right at the start of COVID. So Zoom is still in there, right? But sometimes, maybe the people that you feel closest to, it's no longer about a worry about risk of infection and being exposed to other people, but maybe the people you feel closest to don't live in the area. So being able to see them over FaceTime or over Zoom or talking to them on the phone is going to be particularly meaningful for you. One thing that I would add in here, when you think about stress management and you think about what resources you have that help your system settle and not be like firing in this like uh-oh button. I gotta be in this survival state. Okay. There could be things that are not on this list. This is not an exhaustive list of the resources that people have, right? Like I had a woman who said one of her resources was in the morning, she'd make a cup of coffee and she'd look out her kitchen window. And after she was done doing that, she felt settled. She felt like, okay, I can do the things that I need to do. I have a sense of organization about where I'm going to put my energy, and I feel okay enough, and like I can do those things. Um, when you think about the activities that you do, one thing I would ask you or invite you to reflect on is after I do the activity, does all of my stress and anxiety and worry come flooding back, or do I feel in a different frame of mind? Right? Um, because sometimes we do things when we're stressed, and they're a behavior we do because we're stressed. So as soon as we stop that behavior, we're right back to being mobilized and feeling stressed out, right? Having our signs of stress present. Other things are resources that actually, when we're done doing them, we feel in a calmer, more relaxed physical and mental space, right? So one example I like to talk about is playing words with friends, right? I have some people that I've talked to and they play words with friends, and as soon as they put the phone down, their heart is racing, their thoughts are racing, they're thinking about what's going on in their body, they're hyper aware of their bodily sensations, right? That is a behavior that they do when they're stressed. I have other people who play words with friends, and after they play it for a little while, they put it down and it's like they've just taken a really deep breath and they're like, okay, well, I know I was worried, but I don't feel that way anymore. That's a resource. That is something that is going to help you resettle your system if it has been in this activated space, this activated state because of the stress that you've been under. Now, I want to come to what somebody shared. They said, my doctor said to find a way to rewire your thoughts when you begin to have feelings of worry. I have these feelings most before bed and first thing in the AM. Any suggestions on how to rewire relax? Is this what you're talking about? Yes, right. So, um, what I would say is, I want to be very careful around rewiring worry. I don't disagree with your doctor, but I want to expand on that. Moving into these survival states is adaptive. We would not have survived as a species if we did not get moved into these survival states. And the challenge is that we get pushed into these survival states, even when there's not like a present danger, right? Like, I think you can think about like a soldier comes back from war, a car backfires, and they duck and cover, right? Their system is interpreting that sound as reminding them of something maybe that happened when they were in a war zone, right? that soldier needed that response pattern, right? It just is less adaptive now. It's not applicable now. So worry is is going to be an understandable response to having had to deal with a cancer diagnosis. The question is, can you notice when it's starting to happen? Can you notice be aware of what triggers it? And do you have within your reach things that you can do or reach for, people that you can connect with or reach for that have that settling experience for you? Like I hear you saying, right, bedtime and morning are two periods of time for you when that spikes. And maybe there's other people in here that can relate to that or find that there's other very clear triggers that they experience. So that's beautiful because you're aware it's happening, because now you can make a choice. You can make a choice of, what do I want to do maybe preemptively to change my routine or to see if that helps? Or what do I want to do when it happens? Can I start identifying some resources that help my brain reconnect with the moment that I'm in versus the place that my mind is taking me because something has caused it to uh, respond with that stress response. I would also say that I think even more globally, what I find, and I think is common with the like bedtime morning stress and anxiety, is that during the day we can be very active. There's a lot of things vying for our attention. There's a lot of like physical movement. Like if we tend towards anxiety, we've got somewhere to put that energy. And then at bedtime or when we first wake up, there's no distraction. There's just you and your thoughts. There's nowhere to put that energy any longer. So I think another thing to think about is more globally is to start noticing, like during the day, if I pause in my activities and don't just move on to the next activity, do I have some of that same anxiety and worry that pop up? Because that may be saying, hey, I'm going to benefit from doing things to resource across the entire day, because it's just that I'm more aware that I'm in this activated state at bedtime and in the morning. But it's really something that I'm responding to throughout the day without resourcing to help me settle. I hope that that makes somewhat sense. Um, and I'm going to move on to just the next comment, but we can circle back to that in the Q&A if there's some more follow-up around that. So somebody also said, my docs are always concerned with the blood pressure spikes that come with my anxiety when in treatment. Um, my blood pressure usually goes down 40 points by the time I get home, right? White coat syndrome, like that is a real thing. Then the crash, extreme fatigue for the next day. Doctor's recommendation, more blood pressure meds. I mean, certainly there are some blood pressure medications that actually can sometimes be prescribed for anxiety. Like off-label use is to give it to a person for anxiety because it helps with that sort of loop experience, right? If we keep the blood pressure in check better, the experience of anxiety. I think that's another thing where like we've got like a very specific occurrence that causes anxiety. So thinking about like what's my routine to be gentle with myself in the time going into treatment. What am I doing the night before treatment to take care of myself? What am I using as resources as I'm on my way to treatment? To Because you're probably going to be in a space where you're managing the anxiety without extinguishing it until you're through that experience. Just to be realistic, right? Because you're having to go right back into the thing that causes the anxiety. So can we identify some things that make that more manageable and then also help you recover afterwards? The fatigue, I mean, that fatigue can, fatigue is a difficult thing because fatigue can have psychological causes, right? My nervous system is crashing because I've been in this hypervigilant state. But fatigue can also be a side effect from treatment. Fatigue can be a side effect from maybe the day of treatment being like out of your routine, or like if you have steroids the day of your retreat of your treatment and then you don't have them the next day, right? So there's sort of a like psychological and biological thing that could be working in concert that could be amplifying that fatigue. So I think that's also where some patients, like, what do I need to do to be gentle with myself? I know I'm going to be tired the next day. Like, what can I do to set myself up so that I'm not adding a layer to that of like having negative self-talk around not having a lot of energy, or not catastrophizing that I'm feeling fatigued, but rather maybe leaning into that and saying, what can I do to be a little TLC with myself on those days after treatment? So we can circle back to these because I know this has brought up some comments, and it is also kind of a multifaceted thing that I'm talking about here in a very brief way. I have a whole program I've done before just about your nervous system. So I could talk about this for like an hour and a half, as most of my colleagues would tell you, and probably my clients. So let's talk about physical activity. Lots of research that shows the benefit of physical activity. I'm not talking about going to CrossFit and like lifting 100 pounds and running a half marathon, right? Physical activity is raising your heart rate for a half an hour, 5 days a week, right? Walking. There's been research that just shows the benefits of walking, because we know physical activity, it improves quality of life. It reduces cancer-related fatigue. I think it can be very helpful, even when you're feeling fatigued, to do a little bit of light activity. Sometimes the fatigue, we can get into a cycle where sleep is disrupted. We're resting during the day, then we're not tired at night. We're not getting quality sleep at night. I wake up, I'm still tired, so I'm resting. I'm not getting physical activity, right? We're just kind of going in a loop with that. And so doing some amount of physical activity actually improves sleep quality, which can also improve mood. Physical activity is also shown to help reduce stress, including the symptoms of depression and anxiety. So lots of reasons to engage in some type of physical activity. Coming up in September, we're going to be doing a whole series on physical activity and trying different modes of physical activity. So stay tuned for that in our calendar for September. And if that is of interest to you, I'm sure we can make sure that we follow up with you to give you more specific information. Now, on a regular basis, though, we've got lots of different things. And I have to acknowledge these times may not be 100% accurate, but the categories are, right? So we have yoga 5 days a week. We've got exercise class. We have a Reiki program. We do stress reduction classes. We have a writing lab. We have support groups, right? So if you are trying to find or want to find new outlets and new resources and are open to experimenting, I highly recommend going on our website and seeing what may appeal to you. The nice thing is that with everything from stress reduction up, each class is complete in and of itself. So you don't have to commit to a series. You don't have to commit to a particular day, right? You can kind of try these different modalities out and see what works for you. Okay. So another strategy for empowerment is what is in my control, right? That sense of agency is really about getting in touch with what can I move the needle on, what ball is in my court. Now that can feel very overwhelming. You can sometimes get mixed messages. You can have people in your life making suggestions to you about what you should do with your diet or your exercise or supplements, right? Like there can be a lot of health advice that comes your way after you get a cancer diagnosis, sometimes solicited, oftentimes unsolicited. So some ideas here. What is in your control? Setting a daily schedule. As simple as that may seem, your schedule may, depending on your treatment protocol, have been very disrupted by treatment. Maybe you were on leave from work, and so that structure in your day got thrown aside. or maybe what you were able to do, what time you got up in the morning, all started to be dictated by the cycle of treatment and how you felt in the days after treatment, and then how you felt the week after treatment, right? You were kind of, you might be out of the routine that you were in. So setting a daily schedule, I'm not necessarily saying like you've got every minute planned, but setting a daily schedule, like I'm going to start getting up at the same time, I'm going to take a shower at the same time of day, I'm going to make sure I'm dressed by a certain time of day. These can actually be really powerful things to help feel more in control of your day-to-day existence. Some people choose to make healthy lifestyle changes. For instance, we've got our food and fitness group that just recently started. I think that there's still time to join, that focuses on making nutrition changes, healthy lifestyle changes related to physical activity. Maybe it's also about reducing alcohol intake or smoking cessation. That's something that people often find beneficial. We also have our oncology nutritionist, Lori, on staff that people can meet with individually if they're looking for more individualized advice about how to make certain changes as far as their diet is concerned. Problem solving. Sometimes we have stressors. They're not related to the cancer, but they are stressors that we can actually change. We can move the needle on them. And if we reduce our stress in one area of our life, then it may leave us more resources to have to wrestle with and contend with other stressors, right? So, it could be as simple as like finding a new way to get to work because you find you're always stuck in traffic and it pisses you off when your car's not moving, right? If we can reduce your overall stress by addressing other things, overall, it will leave you with more gas in your tank so that you may not feel overall as drained. Um, the other thing too is thinking about your priorities. Where are you putting your energy? As I mentioned earlier, what can often happen when our energy is compromised is that we put our physical, our emotional, our psychic energy towards the have tos and don't leave anything left over for the things that we want to do or the things that are meaningful for us. Sometimes too, maybe we were stuck in a loop of putting energy into things that really were not particularly important to us, but it kind of became a routine. So sometimes post-treatment becomes a time before re-entering old routines is to say, like, do I still want that in my life? Is that still important to me? Is that relationship still meaningful to me? If I'm saying that time with family is really important to me, but if I look at it and I find that I'm spending very little time with family, do I want where my energy is going to be more reflective to the things that are important to me? And then I always feel like I need to just give a word into following up with your doctors as necessary, communicating with your healthcare team. Okay. Um, Something else that we can do too is this combination of looking for the things, looking for the sparks of light alongside of acknowledging the shadow side of the experience, right? It is not a either or, it is a both and experience, right? Because and you guys already know that, right? I think one of the um the phrases, the experiences that I think encapsulates is that we understand as two emotions coexisting. And I'm not saying that this applies to the cancer experience, but if we think about something being bittersweet, right? What is that? Like bittersweet is it's something that is we have some pleasure associated with it. There's some joy or happiness associated with it, but there's also like a sadness or there's something heavy associated with it. And those two things are coexisting, just as being able to be hopeful and cultivating hope alongside of recognizing that there are going to be things that trigger you to think about your cancer diagnosis, to have flashbacks about things that you've gone through, right? To be pushed into one of those survival states. And we want to find balance within positive thinking. There's this term called, oh my God, it's completely escaping me. Toxic positivity. There we go. Toxic positivity, right? Which is this idea of I have to be positive at all times. It is this brittle holding on to, clutching to the idea that if I am not positive and hopeful at all times, something bad is going to happen to me, right? No one can be positive all the time. We can't. We're just not wired that way. And when we turn towards this idea of toxic positivity, which is I have to be hopeful and positive at all times, then it would be like saying, hey, listen, just don't ever have to feel like you have to go pee again, right? We're just not going to pee anymore. Right? Sooner or later, the urge to pee is going to happen. It is a biological process. Just as sometimes you're going to have moments where you feel less connected to your sense of hopefulness than others. And what is helpful is to be able to have an outlet to acknowledge and to take care of yourself when maybe your hope feels a little further out of reach. And triggers are oftentimes when that can happen, right? We've already talked about the follow-up visits, the scans, the tests, anniversary dates. What may be meaningful to you. Maybe it's the date of diagnosis. Maybe it's your surgery date. Maybe it's going to be the day you finish treatment, right? These are all things, dates that can be triggering. And I was working with a family, and like one person in the family, their date was the date of diagnosis, and the other member of the family who had the diagnosis, it was the date that they had a stem cell transplant, right? So they were both having similar anniversary reactions, but on two totally different days. Birthdays, illness of other people, finding out about other people's diagnoses. I remember when Chadwick Boseman died, that was like very provocative for a lot of people at the in the Cancer Wellness Center community, right? When there's somebody who is very public about their diagnosis, it can be helpful because it shines a light on it, but it can also, when we hear about somebody, it can also be triggering, and especially if there's somebody in the news that's famous that has the same diagnosis as you, or you find them relatable, right? That can be very, very distressing. As I said earlier, you've got symptoms similar to those when you were first diagnosed. Even if, like, I've had people who, like, they happen to get diagnosed with cancer, and the symptoms they were having were not actually related to their cancer diagnosis. It's just as they were getting follow-up care around the medical issue, they happen to be diagnosed with cancer. And so even though logically they're like, I know that the stomach, the appendicitis I had and that pain was not associated with my breast cancer, the brain has already made that link. So now whenever I have like a stabbing pain in my back or my stomach's bothering me, my body is just reacting, right? Your body has gotten primed because of what happened to you. And so when that happens, I think the thing that is beneficial is to have some context to understand why that's happening and to empower you to be able to say to somebody, or even to yourself, I need to take a minute here because I realize, like, hearing about that actor that passed away is really like thrown me for a loop. Or God, my stomach is bothering me, and I know logically it's not about the cancer, but every time that happens I'm just brought right back, right? It can be helpful to contextualize it for you, but it can also open the door to you possibly getting support from your friends and family by externalizing and making explicit what's going on for you. I'll also say, like, heading into the fall, like, October is Breast Cancer Awareness Month. And if I listen to the radio, or put the TV on, like, there are commercials, and there's the walk, and there's the bears are wearing pink for breast cancer. And it's all well intentioned, but it's like you're going along your day and you're not thinking about your cancer diagnosis. And now all of a sudden, they're talking about breast cancer and you had breast cancer, right? So sometimes we can also be caught off guard by those triggers, right? Some of these things you can plan for, which is really meaningful if you know the time is coming, but also recognizing sometimes you're going to have things that just pop up, and to just build awareness, because the awareness then gives you the agency to figure out, what do I need to do in this moment to be able to take care of myself? Okay, coming down to the end here. And I know it's 12:30 here, so I've got one more slide here. Cultivating hope. Okay, hope, psychological hope, is this combination of willpower and way power for reaching our goals. So, do I have gas in my tank? Do I know what I'm working towards? And do I know how to get there? And when I say goals, I call them toilet paper goals, right? Because I've never bought a single roll of toilet paper and just never had to buy toilet paper again, right? I'm constantly going back to Costco and buying more toilet paper. I'm talking about goals like that, goals in your life that you're always working and striving towards, right? Like, a sense of humor is really important to me in my relationship. And it's not like my husband and I share that one laugh and we're like, okay, we're all done there, right? Like, we're always working to infuse humor into our relationship and into our marriage. So what happens when we have cancer diagnosis, often all of our focus, all of our hope gets focused on medical, physical issues, to the exclusion of maybe thinking about the other things that are important to us. And post-treatment can be a great time to start looking in an intentional way, saying, what other parts of my life have value to me and have importance to me that I can be putting some energy into? Because what we know is that having things that are meaningful to us in a variety of different domains in our life can be helpful at our overall sense of hope, and can be protective if one of our domains feels vulnerable, which is what can happen with cancer. I do a program called Building Motivation, which talks about this a lot more in depth. So if this was sparked something for you, I do the program live, and I think we have it on our YouTube channel if you're wanting to kind of understand and talk more about like how hope and willpower, way power goals are connected to one another. One of the things that's wonderful, and I'll end on this note, it's a kind of my hopeful note, is that there are more people now with cancer than ever before. Now, on the like surface, that sounds like horrible, like Priscilla, more people with cancer, like that we want less. But the reality is, it's because there's been so much progress and treatment, and people being able to live longer after diagnosis, right? And so there is reason to be hopeful about what comes next. There's hope to be had around the medical care that you've received, and being able to be connected to a community of other people who've been through something similar. And I hope also that in your own personal life and in your own frame, that in addition to your hope around the cancer diagnosis, that this can be a time for you to reignite hopes about the other things in your life that are important to you. Because while you are and have been a cancer patient, there's also lots of other parts of your identity that are meaningful, that make you who you are. So that's my little soapbox there. Um, I have my email address up here, but we'll also send the slides out to you so that you'll have it. I am going to stop sharing. I can appreciate if people need to get going. I want to thank everybody who was here today, and anybody who is tuning in through our YouTube channel. That I think we can, Lisa, if we want to stop recording, so that if there is anybody who wants to come off mute to share a comment or a question.